Are you overwhelmed by conflicting advice about knee replacement surgery or anxious about what to expect? Imagine finally moving pain-free, getting back to activities you love, and saying goodbye to relentless knee pain without confusion or unanswered questions. Today, I want to give you the straight answers about knee replacement recovery time, real results you can expect, the risks, the cost, and the latest technology so you and your family can make informed decisions with confidence. This is the stuff Google won't tell you. I'm Dr. Tyler Goldberg, an orthopedic surgeon specializing in concierge hip and knee replacement. And for the last 25 years and 12,000 surgeries, I've seen patients literally transformed physically and mentally. I'm on a mission to transform the way the world experiences joint replacement. Ready? Let's hit it. So, what exactly happens in knee replacement surgery? If you've ever heard someone say they have bone-on-bone arthritis, that's no exaggeration. Over time, the articular cartilage wears away, leaving your knee grinding bone on bone. The result, pain, stiffness, swelling, limping, loss of sleep, loss of activity. It's miserable and there's no quality of life with that. On x-ray, this shows up as a total loss of joint space, bone spurs or what we call osteophytes, and deformities like being knock-kneed, which we call valgus, or bow-legged, which we call varus. How does knee replacement work? Step by step. First, let's correct a common misconception. During total knee replacement surgery, we don't hack the bone off above and hack it below and replace the whole knee. We keep your muscles and ligaments intact. We are simply shaving off the arthritic bone and cartilage and capping that shaved bone with metal and plastic implants. The implants then function as a new joint and restore your alignment, your function, and your pain. How about technology? You've probably heard about robotic surgery, computer navigation, or even patient-specific implants. What this describes is the technique that the surgeon will use to put the implants in. Your surgeon will have a philosophy of how they want to implant the knee. Then, in concordance with that, these technologies help them execute on that plan. That's the magic. And here's the deal. They all work really well. Gone are the days where the surgeon is just eyeballing it. Now we have exact plans and precision instruments to execute the procedure. The implants are better nowadays too. There are differences, of course, but they all will work. What you want to do is pick your surgeon and let them determine which technology works best in their hands to get you back to health. For example, I use 3D patient-specific cutting guides for every knee replacement I do. Before surgery, your knee is scanned and modeled down to the millimeter, so we know exactly how to custom fit and align your prosthesis for your anatomy. I helped design the PSI technology, so I use it, of course. I've done literally thousands of cases with it. I know it inside and out. It would not be fair for a patient to come to me and say, "Hey doc, I know you like this technology, but I want you to use this and put this implant in, even though it's not the one you routinely use." That's not fair to me or to you. Pick your surgeon first and trust they have the experience to guide you through the process to get you your result you're looking for. Recovery timeline, realistic expectations after knee replacement. How long does it really take to recover from knee replacement surgery? This is one of my top questions, and the internet is full of misinformation. Let's first talk hospital stay. Most patients are up walking the same day and go home the next day after the hospital. Many patients never have a hospital stay at all and have their surgeries in outpatient surgery centers and literally go home within a few hours of their surgery. Contrast that with surgeries done in Japan, for example, where it's still routine for patients to stay in the hospital a month after a knee replacement. At home, expect swelling and discomfort the first few weeks. Your body just had a major trauma, a surgical trauma, but a major trauma nonetheless. The same mechanisms that heal a bad injury are the same that heal a precision surgery. Most use a walker, then a cane for 2 to 6 weeks. How about back to activities? Most patients are through the looking glass of recovery and they can see the finish line after about 6 weeks. There is a roller coaster of emotion, pain, and dysfunction that occurs, but it all begins to settle. After that magical 6-week mark, patients begin to return to activity and continue to slowly heal for up to 1 year after surgery. That's right. Recovery of a surgery actually takes a full year. That's biology, not wishful thinking. Driving. Driving's an interesting one, and I'm sure there are opinions all over the place on this. I've seen patients drive literally the next day after surgery, and I've seen some patients take literally as long as 4 weeks. Truth of the matter is that driving is operating a machine. In my opinion, if you're influenced by drugs and you can't control your leg, you can't drive. When you're off the pill and you can't control your leg, then it's time to drive. How about work? Work is a hard one because we all do different jobs. A work from home or desk job is faster than, say, manual labor. Depending on what you do, you should plan for 2 to 6 weeks off. That's a small price to pay for a lifetime of pain relief. Take the time, heal, and reap the rewards of your surgery. How about swelling, heat, and pain? Again, this is biology 101 and you're living it. It's normal to have all these for a year. It's just how we heal. Unfortunately, I wasn't consulted during the design phase of this. We can try to modify it to make it more tolerable, but we can't escape it totally. I hope you find this helpful. If you have any questions about knee replacement surgery, whether it's about recovery time or if surgery is even right for you, or what to expect next, drop a comment below or reach out to our clinic team. We're always here and happy to help, no matter where you are on your surgical journey. If you're finding this video helpful, don't forget to give it a like and subscribe. I post expert answers to all your joint replacement questions on a routine basis. And if you know a family member or friend who's considering knee surgery, share this video with them. You never know who you might help with the right information. Now, let's dive into some honest truths and risk and long-term results. Risks and complications of knee replacement and how we prevent them. All surgeries have some risk. For knee replacements, there are always too many to list, but they chunk up to a few very important ones. First, there is infection, which is rare, fortunately, less than 1% in my practice, but it can be catastrophic if you get one. After that, we worry about blood clots, nerve injuries, ligament injuries, and vessel injuries. Swelling and stiffness always happen after surgery. Those aren't really complications in my opinion. Some patients get stiffness that requires an MUA, or a manipulation under anesthesia. This happens in the best of circumstances 5 to 8% of the time. The doctor does everything right, the prosthesis works beautifully, and the patient did everything we asked, and they still get stiff. It happens, again, 5 to 8% of the time. Is that really a complication? Technically, probably yes. Fortunately, MUAs work, and I see patients that come back for their annual follow-up all the time, and their motion is incredible, and they have to remind me that I had to manipulate them. I always say the same thing. Well, you're the poster child of MUAs. I minimize the risk with my time-tested techniques, antibiotics around surgery, and proven protocols. However, things happen, and that's where you really meet the mettle of your doctor. Do they manage the complications skillfully so you overcome that quickly, safely, and as with little morbidity as possible? And one more thing, just making sure I say this again. Pain, swelling, and stiffness are normal at first. Don't tough it out. Take it slow. Less is more early post-op. Remember that. Less is more. How long will your knee replacement last? A common question, how long will my knee replacement last? This is a great question, actually. What you're really asking is what are the failure mechanisms of a modern day knee replacement? There was a time when the plastic of the knee was the weak link. It wore out like a tire. However, for the last 20 years, the plastic made by our industry partners has essentially become resistant to wear, a true breakthrough. So now the reasons a knee fail are not due to wear, but to other causes such as loosening, infection, fracture, and things like that. In the simulators, the plastics can last over 200 years with normal use. Even if we're off 75%, that's still 50 years, which gets most of us where we need to be. That old idea that they last for 15 to 20 years is a myth. If that was the case, I would be revising all my old knee replacements I did 15 to 20 years ago. I'm not. I'm actively looking for new patients, not reoperating on my old ones. I want my patients to use their joints and get back to their life without pain or fear of ruining their implant. Some things you can control, for example, your risk of falling and having a periprosthetic fracture. Most things, like infection, we can never fully mitigate the risk. So you might as well get out there and live life to the fullest anyways. Do you need a knee replacement? Making the right decision. When should you consider knee replacement? I typically look for 3 things that let somebody know they are ready for a knee replacement. Number 1, do you have pain that limits the ability to do the things that you want to do? Number 2, do you have pain that prevents or wakes you from sleep? Sleep, you know, is a vital part of being human. When you can't sleep, you go look for doctors. Number 3, have you tried everything else in the conservative world and you say, enough, I'm ready to be fixed? This is by far the most important criteria. We all arrive at that one individually. Some people want to go straight to getting fixed if they know it's in their future. Some people want to fight with everything they have before they're ready. That old adage, you know when it's time, is just as true today as it was when I started 25 years ago. I've never had to talk someone into a surgery. You will always know. There is a small group of people that don't have pain, and those deserve mentioning as well. When I think of doing surgery, I'm solving pain, 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 and a little more pain. However, down the list of reasons, there are things like deformity correction, improvement of activities of daily living, and stability. Some of us just don't have pain. I'm one of them. I don't think I've ever taken a pain pill through all my surgeries, fractures, and dislocations. Pain just doesn't register for me. And finally, what's the truth about kneeling? Can you kneel on your knee after you have surgery? The answer to that lies in what you do now. Do you kneel on your knee now? If you do, then you will likely kneel after. For me, I'd never kneel on my knee if I had a knee replacement because I won't kneel on my knees now. Kneeling is a function of range of motion and pressure. Some people can take it and some can't. I play golf with a buddy of mine who has a knee replacement, and he kneels on the putting green every time he reads his putt. It's bad form on the green, but at least he can do it. Thanks for watching this in-depth guide to knee replacement surgery. If you want to learn more about knee replacement recovery time, surgery costs, or patient stories, check out our playlist below. Have questions or want expert advice? Book a consultation using the link in the description or call my office anytime. Our team is ready to help. Please subscribe for more real answers about knee and hip replacement surgery.